Center, and we have with us, as we do every Monday, Dr. Pamela Hackert. Welcome.
Well, thank you.
Did you have a nice Mother's Day?
I had a great Mother's Day. It was very nice.
So
can I give a quick shout out to my son Alex, who graduated University of Michigan, mechanical engineering. So we're very proud.
How did the graduation parties work?
Oh, it was just a very small, intimate group. But we had a really nice dinner.
Great. So Bart just went over the numbers, and we've been getting some questions, some curiosity on those numbers as far as the corrections department. Do we know how many corrections officers have been tested?
How many have been tested? I believe they are testing all of them now. They're not doing all of them through Jackson County, though, and so we don't have a firm number, but anecdotally from the people that I see, they are saying everyone is being tested now.
Yeah, so we have in Jackson County, 380 some, actually how many? We have 392 positive cases, and we have 129 Jackson corrections staff. So can we make the assumption that a quarter to a third of the Jackson County cases are correction staff?
Yeah, some of those staff may live outside of Jackson County, but I still think that is a fair assumption.
The latest number of deaths, 25, that it was interesting that you noted we're forecasting almost twice as many. Can you talk a little bit about how those numbers have changed?
Oh, for the overall in the United States? Sure. So those original estimations were based on that Institute for Health Metrics and Evaluation out of the University of Washington. They're independent from the university, but they are based out of that. They were making an assumption at the beginning that everyone would follow social distancing rules and also that they would be able to be tested, because that's what we were hearing at that time. Those turned out to be very optimistic and really unrealistic expectations. And so we saw the numbers start creeping up. It's now, they're based on their same model, or the same place, they're now saying twice that by August 4th. And the reason that they're doing that, I think, is a little bit more realistic methods of doing the evaluation. Do you have that? Were you able to get that little chart?
Yeah, we can pull that up.
Okay. So here you can see their latest one is projected by August 4th, and it has basically doubled from what it was originally. But what they're doing, I think, is a little more realistic. They're looking at each state individually, because we know that each state has a significantly different burden. We have, the state of New York or California with much higher burdens, and then we have some of the middle of America states with very low burdens. Michigan, unfortunately, is still one of the higher burden states, but not in Jackson County. And they're looking at the likelihood of people staying home and still following the restrictions, even though they are easing up on what's required. They still are looking at how likely are people to stay home. And they're looking at the travel that's associated with different parts of the states. For example, here in Jackson County, they would be looking at the MDOC workers, as you mentioned. We have quite a few people who are positive from that occupation, and how far do they live away from this area. And so then one that's in the news everywhere are the meat packing plants. And if you look at where those plants are located, they often are located at the borders of different states. And when they have the borders of different states, they go and live in another state.
Yeah, Coldwater is a great example. Coldwater is close to the border. They have meat packing facilities and a prison.
Right. So they're getting kind of a triple whammy.
Yeah.
And so there's also another one is also they're looking at the testing rates available in those different places. And then they add up all the different states, and that was the number that they are best estimating for August 4th. But even still, they may have surprises if we don't follow the social distancing.
Yeah, we saw over the weekend with Mother's Day, a lot of warmer climate areas, people were out flocking to the beaches, and
I
when the
know.
restaurants had opened up, they were lined up.
Sounds so tempting, doesn't it? You know, it really does.
And you ask people to keep people from their moms yesterday. That just wasn't going to happen at a lot of places.
Right, and so those are the more realistic things. But, you know, as one a mom and to a daughter and someone else, I still urge you to try and resist that, because it's like one period of time that we hopefully will have to do this. So the best thing you can do in Jackson here is to keep our numbers low, which they are relatively, even with the large MDOC burden, is just don't gather with people who are not in your household. And it's not like you do, and I'm not condoning it, but like if you did see someone else on Mother's Day, like just be particularly careful in the next 2 weeks to look for any symptoms and keep isolating, because you were then potentially exposed more.
It seems like, despite the prison, we're doing a good job in Jackson County.
We are doing a really good job here in Jackson County, and I think that reflects people understanding why it's so important to do that, and I think it also reflects care for the community.
Do you have any examples where people have relaxed in social distancing and the consequences have been severe?
Yeah, there's a really good example, because we know that the beaches in Florida are going to be problem centers, but we don't have the contact tracing to know exactly what happened. But there was just a case reported out of California, and they think that one large birthday party that happened in mid-March had extended family and friends, and there were quite a few people not wearing masks there, but one person wasn't wearing a mask and she was coughing, and she was actually joking to people, maybe I have COVID-19, and she actually did. And because they knew exactly who was there, they were able to do this contact tracing, and five other cases associated with that one party, who then went out and caused outbreaks in their own communities. They also think that there was about 5 or 6 other cases of people who lived outside of Pasadena, but they didn't get tested, so they had the right timing, the right symptoms, but they didn't get tested, so it wasn't confirmed.
So contact tracing, that's something we're hearing a little bit about. We're going to be hearing a lot more about that, and we'll find out exactly what it is and how it's being done here in our community when we continue more with Dr. Pamela Hackert after these words.
As we work to get through these times together, you may not be thinking about blood donation, but blood is desperately needed now to save lives of people who are sick with a range of serious illnesses. It's easy and safe to give. If you are in good health, please donate. We need heroes now. Visit redcrossblood.org to schedule an appointment.
Come see why Art Main is the #1 choice for service for so many Jackson drivers. At Art Main, you know you're getting quality work and quality technicians at a fair price. That's why so many of our customers come back again and again. Whether it's a simple oil change or full body repair, Art Main makes it easy with our online service scheduling. We can even text to keep you up to date.
Come see why Art Main is the largest express facility in Jackson County.
Budweiser would like to take this time to say thank you to all our frontline and essential workers who are all working hard to keep us safe and our world moving during the COVID-19 pandemic. From everyone at Budweiser, this Bud's for you, and thank you.
During this crisis, while most of us are at home, our doctors, nurses, and hospital workers, our paramedics, police, and firefighters are putting others ahead of themselves. My family and the local owner-operators of Big B Coffee are grateful to you. So show your work ID at a local Big B and get a cup of coffee on us. It's a small thing, but now, more than ever, we want to say thank you.
Community members wanting to encourage patients at Henry Ford Allegiance Health who are diagnosed with or suspected to have COVID-19 are encouraged to use the Well Wishes feature on the health system's website. Share your words of inspiration, and HFAH will display them on the TV monitors in patient rooms. The process is simple, quick, and will help brighten someone's day.
Jackson Public Schools Kindergarten and Young Fives Roundup is underway. During the school closures, you can enroll your student online or call one of the schools to receive assistance for enrollment. Please visit the JPS website, jpsk12.org, for more information. Go Vikings!
We're driven to be the best. We're Jimmy's Towing.
Breaking down is always inconvenient, and you never know when it's going to happen. From lockouts and flat tires to jump starts, Jimmy's Towing is on the job 24/7, 365. For fast response anytime, anywhere, the name to remember is Jimmy's. Save our number in a safe place, and if you're in an accident, request Jimmy's Towing.
We're driven to be the best. We're Jimmy's Towing.
Welcome back to the morning show presented by the Pick Center, and we have Dr. Pamela Hackert with us, and our numbers overall are good in Jackson, as been reported by most experts in Jackson, so that's good and trustworthy. What do we have to do to kind of keep our numbers down as social distancing kind of relaxes a little bit, at least mentally?
So we do need to still do the social distancing, like we are, again. You know, normally I know you spread out a little more, but this way we're 6 feet apart. The hand washing is critical because, you know, as Bart was mentioning, it can go through your eyes. So you may be wearing a mask, but if you touch your eye, it can go down through the little tear duct into your nose and then get into the pharynx where it likes to multiply. But wearing the masks is really important. It's particularly important if someone's having respiratory symptoms because if you cough or sneeze, the droplets, which we've heard a lot about already, they can go easily more than the 6 feet of social distancing. And there was an article which is kind of convoluted, but the Journal of the American Medical Association, it was reported in the USA Today. So you get both the medical doctors, you know, reading this, and then the general public could read it as well. But it showed how if you have respiratory symptoms, it can go much farther via either the sneeze or a cough, and then it creates this little air. Here's it. Well, yeah. So it's showing it's 100 feet per second, so you can't duck out of it. But also how the respiratory droplets, those little blue dots, they can fall much farther than 3 to 6 feet. But also that plume at the top, that's where it's airborne, and that can go easily then to like 29 feet for a sneeze and 16 to 19 feet for a cough. So that's why when people are wearing a mask, they are, even if they're infectious, all of that is going to be caught by the mask they're wearing. So those surgical masks only protect the person wearing them a little bit, like those cloth masks we all wear. It protects about a quarter of it. But what it really does is it protects you from the people who are spewing the respiratory droplets and viruses.
Yeah, I think everyone's seen people wearing the masks wrong, or half not covering the nose.
I see a lot of people just wearing them in their hand.
Yeah, they pull it down and it's like, well, then you're getting all the worst of it, because if you wear it down here and it touches your nose when it's like riding up or down because you want it under your nose, then what's on the outside of your mask can go up into your nose. And it's another reason to remember when you're taking it off to either drop it immediately in a paper bag and then wash it, or just be really careful to not touch the outside of the mask, because that's where the respiratory droplets are.
Should we be holding our sneezes?
If you're not wearing a mask. And the public health cough, is in your arm, which is not that effective because it still goes out this way and that way. But
I've noticed, I was out a little bit on Saturday, and I had a few things for a pickup. So we had a Target pickup. So call in, pull into a spot, and they bring it out. That's great. The parking lot was packed. There was not there was a couple parking spots, but so my question is, people are going to the stores in masses as far as big, your Target and Myers. So that hasn't stopped.
Right.
So full stores. So my question, I guess, is now if we want to go into the stores, we're going into packed stores.
Yeah.
Should stores be tightening up their requirements? I mean, it seems like they're just letting everyone in, and it's not a big deal.
They're not requiring masks in the stores?
I didn't go in, but I don't know that Target or Meijer is requiring a mask. I'm not sure.
Well, they should really, for the workers, if nothing else, who see a lot of people. But yeah, wearing the mask is a really good idea.
Yeah, for example, you don't have to wear a mask into Meijer, and it's been crowded, and maybe estimates are less than half of the people wear masks. So, that's in Jackson County. We have 4 large grocery big box stores like that, and about so that to me is a little concerning.
I agree with you, and I really urge everyone who's listening and everyone who reads anything to wear your mask, because we all want to move forward with reopening. It's hard to put the genie back in, and you have to protect yourself though, because we don't want Jackson County to make that data miner that I talked about last week. We don't want them to be right that this is one of the next hotspots in the country.
Yeah, the governor's order requires masks be worn by both the employees of the grocery stores and the customers. And Brandon was at Meijer on Saturday, and it was packed, and he estimated about a third of the customers were wearing the masks. So, yeah, it's concerning.
Very concerning. And if you, I know the weather wasn't great, but still you could find other things to do that would keep you away from other people if you are not wearing a mask.
Well, contact tracing, that's something that over the weekend we heard the governor has engaged a firm to do contact tracing in the state of Michigan with both paid people and volunteers. Mm-hmm. We've been doing it from day one in Jackson County, and I think all health departments have been doing that.
Yes.
That's really where everyone at the health department is overloaded with work.
Right.
Right? So explain how what is contact tracing?
Sure. So stepping back a little bit with it is, we originally tried to do the social distancing, the stay-at-home orders, and that's where we still are here in Michigan, and still with a lot of the country, but we're going to be moving towards reopening, because one of my personal medical heroes is actually Dr. Tom Frieden, who is the head of the CDC between 2009 and 2017. But he was also the health director for New York when they were having big multi-drug tuberculosis outbreaks. So that's how I started following his information. But I loved his quote, and it said, "Sheltering in place is a very blunt instrument, but it was the strongest tool we had to confront the pandemic. But it also has these horrible consequences of economic consequences. And so we want to use that whole staying at home as sparingly as possible." And I don't know, have you read about how they have said that we may have to go back if someone has the outbreaks? Sure. And start, you'd have to go back. Well, I don't want to go back anymore. Once I come out, and I'm still being very good about staying home, but once I come out, it's going to be very hard, almost, mentally stressful to do that. Mm-hmm. So we want to figure out how to do it as sparingly as possible. And what we can do now that we have more testing available is to do this contact health tracing. So if a case is identified, we want to make sure that person's isolated, and they really mean stay at home in one room. Take your meals alone in that room. So someone ideally would drop them off. If you live alone, obviously, you don't do that. But don't interact with your family. Don't even kiss your kids goodnight. Just act like you're really somewhere else. And then also, though, they find contacts of that person from the time they went into isolation going backwards to 48 hours before they had symptoms. And
It's probably easier to do. We're probably more mindful of all our actions today.
so true.
And we're doing a lot less.
We're doing a lot less. It's like people say, "Are you free on Saturday?" It's like, yeah, I certainly am free. I have nothing going on. But so you're right. That's so much easier to find out. But if someone's been in a workplace, that would be the main one that you'd be still wanting to look at contacts. But this is really the key, and I think it wasn't very clearly said at the beginning. Is the context of the quarantine we're told to stay at home. The context of the person who's positive. They were told to stay at home and self-quarantine. But it really has, and I think I said it from the beginning, but I was kind of like looking at other places, but they really have to stay in that one room too, which is so hard when you're feeling perfectly healthy. Or stay outside, you can be outside too. But they have to stay away from everybody as well. 20% of the cases have been a household contact. That's where they got it. So if we can keep people from interacting while they're in that quarantine phase to see if they're going to become ill, then we reduce our cases by 20%, which is a lot. And so these things stop the chain of transmission, and that's what we were trying to do with the stay-at-home orders, is stop the chain of transmission. But you can also do it with this finer tool. Instead of the blunt instrument, you can do it with a finer tool of contact tracing. But people really have to do it right and stay home.
How difficult is it, for example, with corrections? You have some that are staying in hotels or visiting their family. How hard is that contact tracing? And is there any data yet available on the contact tracing for corrections?
For corrections? I don't know if there's data available. I know that we certainly do it. And I have seen people whose spouses have, or significant others in the home, have become ill as a contact of those people. But the message really has to be like, even if you were in contact with, your household member just before they got sick, or even the first day or two they were sick, you still both need to separate, because your immune system will fight it off, but it's not going to fight it off forever. And so that, I don't know if I've seen anyone do that contact tracing data.
Yeah, we've heard some stories from the corrections officers who are staying in a hotel, or they're staying together as a group. Once a week, maybe they will go home to see their kids and family, and I don't know much more about that, and hopefully they're doing it through a window or with a mask. It's a great sacrifice that these people are doing. It's in some cases 50 days so far.
Right.
Dr. Pamela Hackert is with us from the Jackson County Health Department and Henry Ford Legion's Health. More of the morning show after these messages.
JTV Studios is your local source for high-quality video content. Whether you're looking for a touching testimonial, an exciting commercial, a fun educational film, or a useful safety video, JTV Studios can create engaging content at competitive pricing. We've already helped dozens of businesses, big and small, to train, promote, and grow. And we can do the same for you. Call or visit us online for an estimate today.
I've been a Kelly Express Smart customer for years, and there's a simple reason why. I stop at my Kelly Express Smart every day when I take my kids to school and go off to work. The entire staff is friendly, and the manager even saves me my favorite morning paper. The service is always fast, which is great for a family on the go. Kelly Express Smart has everything my family and I'll need to get our day started, especially fresh, hot coffee. There are locations all around Jackson, so I know that there are quality products and fast, friendly service just around the corner. Kelly Express Smart, they're the best.
Why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
So we're asking everyone to be selfless for others so that we can protect those who are most susceptible.
Not going to bars, not going to restaurants. It all just means physical separation so that you have a space between you and others.
For more information on how you can social distance, please go to coronavirus.gov.
At Arbor Manor Rehabilitation and Nursing Center, our staff is committed to helping patients maximize their rehabilitation potential. We believe healthcare goals are best met by putting patients first, and patients are not just their healthcare challenges, they are people first. That is why the needs and preferences of each individual lead the way in how we provide care.
I was hesitant. I did not want to come, but then I started realizing that it was my time to relax and take care of things.
My experience here with Arbor Manor was wonderful. They was very encouraging.
People here that I've met, and it's probably the whole building pretty much because I walked around a lot, are amazing, are simply amazing.
I don't think I would have recovered as fast without Arbor Manor.
They treated me like a princess.
The coronavirus pandemic is an incredibly trying time, but we're here to remind you that there is light at the end of this tunnel.
King David writes in Psalm 30 and says that weeping may last for the night, but joy comes in the morning. We have hope that joy is on the way. We just have to keep fighting.
I'm proud of the way so many of you are serving this community. Keep going, Mid-Michigan. We'll make it through together.
Welcome back to the morning show presented by the Pick Center with Bart and Andy and our guest, Dr. Pamela Hackert. And we've been talking contact tracing and how we're doing in Jackson. And is there anything else anyone should know about contact tracing?
Yes. One, they are doing enhanced contact tracing now. They've been wanting to do that through the state with the state help, but it was slow getting going. But now I think that it really is on the path for that. But they have to be kind of particular in who they get to do contact tracing. I know we've had a lot of people say, I can do contact tracing, I'll help, I'm happy to help, plasma, contact tracing, whatever you need. But you have to have some medical knowledge and also a great deal of people skills, because this is a very hard thing to do. So you're calling someone who's already been diagnosed, they know that they have it, but now you're asking them to tell everyone that they have been in contact with. And sometimes, one of the most important things is understanding patient confidentiality and to be able to project that to the person on the telephone that you will be keeping this confidential. This is not something that's going to be plastered all around, because as you mentioned, some people, may have violated what they were supposed to be doing, but they're not going to get in trouble for it. Like this is totally disconnected from the enforcement. This is like helping the people you had contact with not get ill and spread it as well. So they have to be able to recognize, like if someone's getting worse. This is for both contact tracing and also monitoring the people while they're sick. But they have to know when to recommend they get more medical help. And sometimes, as you guys know, the virus can present in very weird ways. Most people talk about the cough, the fever, but you can also have horrible diarrhea, vomiting, and that can throw all your electrolytes off. So that's a whole different type of medical presentation. Sometimes you can get an ear infection, and if you call your primary care doctor, they may think it's a bacterial infection and give you amoxicillin, but it's really related to this virus. And so that's what you need. You need that. You need to get a lot of personal people skills, being able to get people to share things with them. But you also want to have a toolkit of help available. So if they need food, if they need medications delivered to them, you want to be able to offer those things to them so that there's a benefit to both sides in working with these contact tracers. And I know that the state is now requiring that reported contacts be at least tried to contact within 24 hours of hearing that. So I think that's going to start working really well too.
We've heard too that the contact tracers, they're reaching out to people via telephone, and they're having a hard time getting people to just answer the phone.
It's true, because you know how the last 10 years we've all been so taught to look at your phone and say, oh, I don't know that number, or you know, it might be spam. And now you have to actually answer those. So luckily, I think there is also a movement going on right now to have more say over who's calling you on those phones. But that is the biggest key, is actually to answer your phone, or if it does go to voicemail, to read your voicemail or listen to your voicemail and respond and call back. Because one, you're supposed to be staying home if you're sick or at quarantine, so you have time to do it. But really, this is the way to stop the movement of making people go back into their homes and stay there. This is the way of the future.
It's got to be hard for someone getting that phone call, because you would be saying to them, you've been identified as someone that's been in close contact with someone who has COVID or has the symptoms of COVID. My first question would be,
who? Of course, that is the first question. And I think that once people realize that they're not going to get that information, it actually makes them more encouraged to give out their contacts, because it's going to be confidential.
And I'm sure, it's, if you get it and then you get a call, you're embarrassed that you have it just, for no reason, but, going back and thinking, okay, yeah, it is hard. It's probably pretty hard to remember everything, but so important to be truthful on that call.
It is so important to be truthful and to remember that it's not something that's going to be written down all over everything. It's not going to go in your permanent record. It is really just to use in this situation to let people know that they need to stay away so the rest of the world can keep going.
So we're staying home and staying safe in Michigan for the most part till the 28th. So we have 17 days more of kind of what we're doing right now. Anything that you can think of that we should be extra careful about or planning as we do engage more of the economy?
One, I would try and find really good masks. While we appreciate everybody's, masks that they've been making, because we had none, I think in the next 2 weeks you should try and look for ones that fit your face really better, because that will help you, not get ill. Right now, masks are really designed more to prevent those droplets from spreading. But if you have a closer fit around the face, that will help the droplets from sneaking in as well, or that air from sneaking in. What else to do?
And the masks, they're hard to find, the supply, to buy the surgical mask.
Right, and the surgical masks, though, are designed, again, to stop the surgeon from spreading illnesses, not to get them to come in. I did just, I don't necessarily want to give out a unsolicited recommendation, but they're starting to come out. Last night I was quite surprised to see a clothing company that I occasionally shop at online. They had their parent company was selling masks, and they were 2 for $10, which was very reasonable. You could rewash them up to 30 times. They had antimicrobial stuff in it, and the more importantly, though, it also had a very tight fit, and it had a band that came down around the lower part of your neck, because ones that loop over the ears don't fit as tightly. So I would do that, and actually thought about doing that for myself. They were selling gloves, these like things that you'd wear, and then when you went into a store, you'd pull it down over your hands so you could touch things through that. I thought that was a cool idea as well. But really, like, maybe think of things you can do this summer that aren't necessarily the same things you did last summer, but things you might enjoy doing that have more social distancing between them.
It's probably been a blessing for our state that it has been colder as far as limiting the spread.
You are an optimist.
But, well, not a blessing for everyone. The industries that depend on nice weather and people, it's obviously not. But I think yesterday would have been an example where, had it been 70 degrees,
Right.
and sunny all day, it would have been a lot different. People would have.
Oh yeah, forget it. You're
Yeah.
going to start to see some backyard gatherings for sure.
For sure.
It's just be safe because we're living with it at this point.
Yeah.
Yeah, and I think the picnics and all the things that are associated with nice weather, it's going to be very tempting.
So when you had, if you have those kind of gatherings, you could also talk to your children about if you fall, if you need help, unless it's a real emergency, try and find your mom or dad and not go to your friend's mom or dad, just so that keeps the distance a little more. Those kind of situations, like what would you do if you, had a bloody knee at your friend's house? You could always take a paper towel and come home, kind of thing. So it's like just those little things, but it will keep people safer.
Great information today. Thanks for being here.
Thank you.
From the Jackson County Health Department and Henry Ford Allegiance Health, Dr. Pamela Hackert. We'll continue with the morning show after